All right. Hello, Dr. Vinny, and hello, everyone joining us out in Facebook world and on here. Um, Thank you for joining us. This is the Invincible Health Series with Dr. Vin, and since we had such a robust discussion last week with our long haul COVID topic, we thought we would revisit it and allow for more questions, kind of give you more information about other things that are going on as far as treatment goes, and to help manage those symptoms that may be longer lasting. And, we had some good news today. We heard from the CDC that, we are at a point in this pandemic finally where being outside and even being inside, the majority of the people, are a large enough portion of us are vaccinated that we can kind of take that step into normalcy. So that was good news. But a lot of people are still dealing with this long haul COVID. So I wanted to turn it over to Dr. Vin to give us some more information about what it is and what we can do about it. So, Dr. Vin.
Thank you, Krista. Hello, everyone. Beautiful sunny day out there. Hope people have enjoyed that a little bit. I got outside for just a couple of minutes today. Made just a little bit of vitamin D, so it's important that everybody do that. But yeah, so long cold COVID, people who are experiencing symptoms for weeks, months, many months for some people. People complaining of things like continued shortness of breath, continued fatigue, headaches, just almost like for some people, almost like a low-grade flu that just won't go away, just not feeling well. We talked about some of the, the routine things, the foundational things that we do in integrative and functional medicine last week. And just to review that quickly again, eating an anti-inflammatory diet can be very helpful, a lot of phytonutrients, activity as, your condition permits, just walking a little bit even to get going, making sure you're sleeping well. That's always extremely important. And finding ways to deal with the stress, whether, that's just a relaxing hobby or that's something more formal like meditation, Tai Chi, or yoga.
Right, absolutely.
Is always very important. So those are a lot of the foundational things. We talked about maybe some of the supplements that we used last week, things like mitochondrial vitamins, because it's felt that long haul COVID is often due to having a mitochondrial dysfunction, immune system dysfunction. So things like mitochondrial vitamins that help the mitochondria work in a more efficient manner, things like anti-inflammatories to help calm that inflammatory response that comes and help the immune system work better. Things like that can be very helpful. Vitamin D is key in helping modulate the immune system and is part of any protocol for dealing with either acute COVID or long haul COVID. And, things that help the body detox better, things like glutathione are helpful. Vitamin C has a long history of being used for its immune support to be helpful to people. Quercetin, an antioxidant and immune modulator. So, those are just some of the supplements that can be helpful to use for the immune system. And as you enhance your immune system, it's better able to take on these challenges. So those are kind of the foundational things.
Yeah.
But there are ways that you can go beyond that. For example, people can use saunas, heat.
Mm-hmm.
Heat, our body, during the acute phase makes, its own heat, fever, we call it. And that helps your immune system work better, kind of improves blood flow, helps the natural killer cells in our body work better. So better able to deal with viruses. Usually in the more chronic phase, we're not developing fevers anymore, but you can, by using some type of heat therapy, whether, sauna of some sort, you can raise your body temperature some.
Yeah,
If you have any type of medical condition, always check with your doctor though before you do that kind of stuff, just to make sure it's safe for you. But for the vast majority of people, it's safe, and again, it helps the immune system work better.
it's
It will,
relaxing too.
and it's relaxing, so it helps with the stress part of it, right? Yes,
Absolutely.
good point. And that is something that people definitely need help with during long haul COVID. They need something to help them relax and de-stress. Um,
Absolutely. And
so
we do have a detoxification package actually right now at the center at practice, and it's a combination of the infrared sauna that you just mentioned, combined with some sessions on the healthy wave mat, as well as the detoxifying foot bath. So all of those things kind of help with the detoxification process. And like I said before, it's very, stress relieving and relaxing. So there's really,
absolutely.
it's a win-win situation.
Absolutely. Absolutely. Another therapy that is utilized is hyperbaric oxygen therapy. Now, when I was doing in conventional medicine, the only, I knew that there were hyperbaric chambers, but those were usually for people with like wounds that wouldn't heal, or they had decompression sickness or something like that. Those get those can get, that's fairly high pressure that they're using for that.
Right.
There are now some portable chambers. Well, those are hard chambers. The pressure is contained really well. There are now soft-sided chambers that maybe get, instead of like 2 atmospheres, like 1.3 atmospheres. So, some extra pressure, but it does force more oxygen into the blood. And that is very beneficial for people. It can help. I mean, we're talking about long haul COVID now. When you give people more oxygen, their immune system works better, your respiratory system works better, your cardiovascular system works better, and as your systems work better, your body is better able to deal with those challenges. You get more. Mitochondria love oxygen. It helps the mitochondria work better. I mean, that's their main, thing that they're working with.
Right.
In addition to all the cofactors that we give them to help them work better, but oxygen is, what they're using to help create energy.
Yeah.
So, the hyperbaric oxygen therapy, we may have one here in the future. Right now, I know that there are some, there are gyms in the area that have that you can utilize. Certainly, you can't go in there when you have acute COVID, but if you have recovered from acute COVID and you're past that stage where you're infectious anymore, then something like that could be considered an option. You often have to do that for a period of time. I'm sure they have packages that you can sign up for. But yeah, that can be extremely helpful. It's helpful for people with heart disease, and that's one of the reasons I'm interested in it, because I have coronary artery disease. I've been doing all the right stuff, but this is something that's going to be an enhancement to what I've been doing. Also helps prevent dementia, or some people, if they're in the very early stages, can help with, some people have even found that you can help reverse dementia. This is not, a cure-all by any means, but certainly could be helpful. Again, more oxygen going to the brain.
Yeah, as you said, it's like an enhancement to whatever kind of protocols or treatments you're already implementing into your body and routine. So,
yep, absolutely.
I wanted to ask you, just on the hyperbaric chamber topic, I know when COVID first hit, a lot of the times people were, testing their oxygen levels. So is long haul COVID, or as a symptom of long haul COVID, still lower levels of oxygen?
Yeah, most people's oxygen has returned to normal.
Okay.
If they have long haul COVID, but even though the oxygen is normal, they're oftentimes not able to utilize that as well, because they feel that there's been damage to the mitochondrial membranes.
Got it. Okay.
And that's where the hyperbaric oxygen, pushing oxygen right to the mitochondria. Normally the oxygen is in just being carried by the red blood cells, but when you do hyperbaric, it actually gets pushed into the blood serum plasma and can have effects that are more powerful than just the blood oxygen. So,
Yeah, I was
yeah.
wondering because I know that, that was like one of the biggest things. People were testing their oxygen levels and their children's oxygen levels because they couldn't tell, it was one of those things where you weren't sure what was going on because everyone had different symptoms and all of that. So it's good
Yeah.
good at least that people with long haul COVID are getting their oxygen levels back to normal.
Again, back to normal, but they're still experiencing that shortness of breath and fatigue that we're trying to overcome, again, by enhancing mitochondrial health. So.
All right. Is there anything else that may be available to people or any other information you want to pass along about long haul COVID that may be of interest to our viewers?
I know Ivermectin's been in the news quite a bit as a treatment for COVID. I've talked to some doctors who have used it in long haul COVID, and anecdotal reports are that it has been helpful. So that's something else that can be explored with mostly, integrative practitioners usually. Usually folks in the conventional medical establishment aren't looking at COVID at ivermectin as either a treatment or a support for long haul COVID. So, but that was interesting news to me that I've talked to some people that have done that.
Interesting. Yeah, it's interesting what you'll find in the integrative health space that you won't, which is a lot of things. Yeah, well, great. Thank you so much for all the information. We have someone watching on Facebook, so if you have any questions, feel free to write it in there. And again, if you have experienced any of the symptoms that Dr. Vinny talked about, and you want to, maybe just get some questions answered, you can feel free to give our office a call at 609-512-1468. It's a free discovery session. You can go over any concerns or just, questions you might have, and we can help you and go from there and schedule some time to meet in person. So
one other thing I did want to mention is that there are also anecdotal reports from people who have had COVID and have long haul COVID, that some of those people, when they are vaccinated, are saying their symptoms are relieved. I had somebody in the office that was the case. She was a nurse, had COVID like last April, and she came in like December, January, and had gotten vaccine. And with her first vaccine, her symptoms of shortness of breath and fatigue had lifted.
wow.
So, it was like her immune system was stuck and couldn't quite make it the extra just to the finish line. And when she got the vaccine, it was enough of a stimulation to push it over there. And it was. I didn't even get a chance to do any of the special stuff I wanted to do to her. She just got better.
She got better. Well, that's always a good thing. Not something that is a problem. So that's great. And also just good information to have. It's, I feel like every person has a different reaction, and there's always something new to learn, but it's always good to have the knowledge.
Yeah. Yes, indeed. Yes, indeed.
Don't think we have any questions, but again, this is just good information to have. Feel free to share this along with anyone that may be experiencing long haul COVID. And again, feel free to contact us if you have any additional questions. We will be back next week, and we'll be talking about Lyme Disease Awareness Month. May is Lyme Disease Awareness Month because people are going out and it's spring and it's nice, but we have to remember that Lyme is a prevalent issue still, and Dr. Vinny will be discussing how Lyme disease affects our cognitive function and what we can do about that. So please join us next week at 4:30 and learn some stuff about Lyme.
I have a question for you, Chris. Did you have any questions about like the masks or anything like that? Or?
Yeah, well, I wanted to know, I know that, I mentioned it in the beginning, how the CDC did announce today that if you are fully vaccinated, you can take off your mask indoors or outdoors at this point. And, that seems like it's a step in the right direction. So do you have any thoughts on that?
Yeah, I do. I mean, I think certainly transmission outdoors is very low anyway. And, with people being vaccinated, You know, it doesn't, you know, I know people like to say, well, that doesn't prevent you from getting infection. It doesn't. It certainly prevents you, you know, at least the evidence I have seen shows that it prevents you from getting a severe infection. And with that, your viral loads are much lower if you do get infected. But again, it's a small percentage of people who are actually having breakthrough infections at this point. So I think it is pretty safe, especially outdoors.
Yeah.
And you know, if people are vaccinated, if most of the people in a room are vaccinated, I think it's fine for people to take off their masks and
yeah,
start having normal
yeah. I
looking
think
conversation, seeing what people actually look like.
yeah. I know it's going to be weird seeing the lower half of everyone's face this summer, but I think everyone's very excited, but almost like we've been. Sorry, my kids are very loud outside my door, but we've been in it for so long. It's gonna take a little bit of time for people to get used to living life without a mask and going into stores without masks. But I think we'll get there.
Okay. Yep, I think we will. Yep, I think everybody's ready for that.
I think
And
so too.
you know, what did I see last night? I think maybe about 40% of people are fully vaccinated, and about close to 58%, I think, had at least one shot.
Yeah.
So, you know, when Israel reached about 60% penetration, and they were just doing one shot.
Right.
You know, they were more. They wanted to get more of their people vaccinated and then pick up the second vaccines later. When they got to about 60%, the cases really started to go down. So,
Yeah.
you know, we are seeing that decline now in the
Yeah. I mean,
U.S. So,
when I was listening today to the CDC director, she said that the cases were going down just even over the past 2 weeks by like a third or something, pretty significant. And then they did just say that children 12 and over are now eligible. So that's another big portion of the population to include in that as we move forward. So
yep,
we're getting there.
we are indeed getting there. We're indeed.
But
So.
we'll still be here, for the long haul, for long haul COVID too. So it's going to help. I'm big on puns, okay?
Yes, indeed. Yeah. So, right. If anybody has any questions, please, yeah, just feel free to contact us in various ways, and yeah, we'll be there for you.
All right. Well, thank you so much, Dr. Vinny. We'll see you next week, and thanks everyone for joining us. And we hope to see you soon.
All right. Thank you, Krista.
Take care. See you soon. Bye.
See you soon. Bye bye.